Assalamu alaikum. Welcome to Agahi with WARISA ZAINAB. Culture plays a significant role in the lives of people, societies, and different countries. People perceive illnesses, health, death, beliefs, moral values. Everything is shaped according to their culture and their cultural beliefs. In this episode of Agahi, we will discuss how the impact of culture changes our perceptions, our mindset, and how it impacts our mental health. In our show today, we have two fantastic guests who are going to join us. We have Dr. Abdullah, who is a research physician who's going to join us all the way from Austria. We also have Brother Zabair Hussain, who is a cognitive behavioral therapist and is joining us all the way from Manchester. Assalamu alaikum.
Walaikum
Alaikum
assalam.
assalam wa rahmatullahi wa barakatuh.
Thank you so much for joining us today.
You're welcome.
So,
Thanks for having us.
Jazakumullah khairan. So, Brother Zabair, first of all, I'll ask you to tell our viewers what kind of perceptions people have that are shaped by the culture and the society that we live in, and whether it has any kind of effect on the way we think and the way we perceive things.
Sure. Thank you so much for such a beautiful introduction. I think culture and society plays a massive part in our physical and mental health. Culture guides what is acceptable, what is not acceptable, and society can impact our self-esteem as well, because society can exclude you and include you as well. Therefore, it's really important to think about our culture and society, and essentially, culture and society can govern if we are to seek help for our mental health problems or not. If we're living in a society where mental health is considered very negative, and there's a very negative narrative about mental health where it's considered taboo, there's a lot of stigma, it's considered a form of weakness or an illness that should not be part of our culture or society. People will be reluctant to come forward, even admit they have a problem, and therefore they will be extremely reluctant to seek help. I think one difference we need to make very clear, there's a difference between religion and culture. You know, religion can provide the guidelines and rules on how we should live our life, how we should treat other people as well. But culture, unfortunately, can be more stronger for people, and people live according to cultural norms and narratives rather than the religious norms and narratives. And I think recently what we have seen in the media as well, culture also guides the differences in between the perceptions of men's mental health and female mental health as well. Unfortunately, it's almost seen as though, you know, culturally it's unacceptable for men to show their emotions, to show any sign of weakness and show that level of mental health. Whereas with females, it's considered kind of normal in cultures that it's okay for them to cry, it's okay for them to express their emotions as well. And we see this in the clinic. Alhamdulillah, you know, we've been working very hard and we've managed to set up a psychology service in Iraq, the Al-Ataba service. And even in there, we have seen that I would say 80–90% of the referrals are female rather than male.
Right. Dr. Abdullah, what are your thoughts about this? Because surely it's not just something that's prevalent amongst the Asian culture, but something which is quite commonly observed in the Arab culture as well.
Yeah, right. Thanks for the question. Indeed, what my colleague Zubair said exactly, and I would like to add that many things affect this, let me call it stigma on the mental health. One of them, the media and politics, how it played a role. For example, it's connected a lot in the media, those who do crimes or any problems or anything, something not normal, they will be entitled this problem as mental health problem. So people start to see the mental health problem connected more for criminals or those who do anything, killing people or abusing others. So there, like in addition for the misunderstanding about the mental health, we start to get that stigma. Many people in Iraq, especially, and even I saw it here in like Europe, when we talk about psychology and mental health problem, the first thing is that I'm not crazy. So they take it,
Mm.
mental health problem means just to be crazy. So
Yeah.
plus that type of the nature of man to be like he want always to be seen as independent, as the one who can manage everything. Then seeking help, especially for things which is not physical seen, usually become problem for them. Yeah. So they don't like to be seen
Yeah.
as a weak. And this is part of the nature. Yeah.
And how does that affect in people's attitude towards illnesses? For example, if someone is going through a psychological, um, difficulty or mental health difficulty, how does culture and the society that they live in, how does that help the individual in seeking help or maybe not seeking help?
Well, it's a big barrier indeed, and the problem. Yeah. So the question for me or for my colleague Zubair?
You both can answer, anyone.
So maybe
I'm getting
like Zubair will
perspectives from
start.
two different cultures. I'm getting it from
Yeah,
the Asian
yeah,
culture and from the Arab culture.
yeah.
No,
So
please
let
do
Zubair
continue,
start.
Dr. Abdullah.
So the first problem, first we have to put it in that uh, clear meaning that we shouldn't generalize it, but we understand that there is groups in the society. There's people who already open for mental health problems. When we talk, we said, okay, I understand it, and they seek help. Others who need some explanation, like we saw many patients when we, or clients or people, when we explain to them how important is mental health, how it like valuable, like when you visit a psychologist or psychiatrist, you will gain this big like benefit from it, then you live your life much better, then they go with it normally. Others refuse, indeed they still need a lot of education.
Yes,
Sometimes educating the family itself will play a big role here, and open the people or those who suffer from any problems to talk more. Sometimes the client or the person who suffer from the psychological problem want to talk, but the atmosphere or the family around him or her, if they are not open for such a thing, they will be a barrier for the individual to seek the help. So indeed,
definitely.
we work like, and we see one of the duties that we share that psychological education and that understanding for mental health to make the society step by step accept it. Many good advantage we just saw it, like many people start to change. Others still need time. Yeah.
Yeah, definitely. And I also agree with what you have said. And like Brother Zubair pointed out, that in certain cultures, men are seen as someone who shouldn't express their emotions or shouldn't talk about the difficulties they are facing. And that is quite damaging. And that is something which is seen not just in the Indian subcontinent, but also people living in the Middle East. So, Brother Zubair, you see a lot of patients who come to you with different kinds of mental health difficulties. Do you come across individuals who delayed seeking professional help just because of their families or the attitudes of their friends and family members towards mental illness?
Definitely. I think just going back to a point which Dr. Abdullah made, that men are often seen as independent. They're often earning the money in the family. They're often providers in the family. And we see this in the subcontinent, Pakistani Indian culture, but we see this in the Arab culture as well, whereas the wife, stays at home, looks after the children. So the man has a lot of responsibility, a lot of expectations, a lot of duties on him. And therefore, for him to maybe admit or show some signs of mental health, he may be reluctant to do that because he may feel his role in the family may change, and the attitude towards society which people have towards men who maybe are struggling can be quite negative. So it may stop them. I think we see many, individuals with a wide range of mental health problems. Just going back to an earlier point, we don't live in isolation. Even though we live in
Mm,
the West, which is considered an individualistic culture, there's still pockets of our community, our society, even in Europe, even in England, where it's a very community-based culture, and that will definitely govern our attitudes towards seeking help and how we treat mental health. What we do know, and the statistics show, that more men and women from the BAME culture or diverse culture present at mental health services at crisis stage. And the reason for that is because they've been trying to cover the problem, deal with the problem, maybe going to like herbal healers, religious healers, spiritual healers, trying to find some sort of healing through the Quran maybe, or some sort of religious kind of healing, but only when it comes at complete crisis stage, where the family kind of recognizes, actually we cannot manage this problem anymore. It has become extremely problematic and extremely risky maybe as well. Then they present at crisis stage, and this is very common. We see this delay in the treatment. And what we do know, all the professionals and research tells us, early intervention is key. If you can intervene early, recovery is more likely as well. Whereas at crisis stage, it can get more complex and difficult to treat as well.
Right. In terms of seeking help, like you said, this is key, that if it's not something which is received on time, things can aggravate. Illnesses can turn into something which becomes hard to treat. And sorry, I'm just going to take one call.
Sure.
Yes, Assalamu alaikum. Do you have a question that you would like to ask?
Kazim from Manchester. And regards to both of the guests, my question is, usually we see people talking for others on the back, and most of the time they discuss about negative for the people who are not present. Is that the required mental? Is this a mental issue? Like, do they need to see the doctor? Because there are so many people who talk on the back of others, and they are in this habit of talking and discussing their personal issues or their personal experience and trying to portray the people which are not present there, negative and character assassination and etc. Does they require mental health help? Do they have to? Is it okay to advise them that they need to see a mental health doctor? And this is very common in our culture. Is that common everywhere?
Yeah, thank you. We'll ask Dr. Zabair and Dr. Abdullah what their thoughts are on backbiting, character assassination, and whether this is linked with mental health. So, interesting question, Brother Zabair.
Sure. Thank you, first of all, for the caller to asking this. I think this exists in every community and society. I don't think it's particularly just prevalent in the South Asian or Arab community. I guess there's a difference between mental health problems and mentality. We can be quick to diagnose a problem, but sometimes we need to normalize the problem. So rather than calling it a mental health problem, we need to be careful that we're not trying to make it medical, almost, the issue. When there's situations like this, as therapists and psychotherapists, we look at the function behind that behavior. So let's say, for example, somebody who might be constantly or relentlessly talking about other people. We like to understand why they are doing this. What's the function? Is it maybe low self-esteem, that they're suffering from low self-esteem and this is a defense mechanism? Maybe trying to hide something in their self, maybe, and then talking about them? Is this because the culture and community they've grown up in, it's acceptable, it's normal? Almost if you don't backbite about somebody, something's wrong with you. You can't talk positively all the time. So I guess there's no straightforward answer to that question. You need to look at the function behind the behavior, why the person is doing this. It may be just because of the culture, the family upbringing they've been brought in. It might have been considered normal. This is normal behavior, acceptable behavior, therefore let's continue. Or it could be a symptom of a mental health problem. If somebody's suffering from extremely
Right.
low self-esteem, or maybe some unresolved anger, maybe, I've seen this a lot, where they will become extremely angry about society, angry about other people. And that's because there may be some unresolved trauma in themselves or unresolved anger issues. And this is why they're talking about other people. So until we don't know the function behind the behavior, we can't really generalize why that person is doing this.
Dr. Abdullah, what are your thoughts on this? We just received a call, and the caller wanted to know, there are certain people who are, you can say, chronic backbiters, or they do character assassination. So is this something that, should be considered as a problem?
Well, my colleague Zubair, as he's more special in this field, he explained it more clearly. What I will add that first, it is in all communities, like we saw it in all communities. I'm original from Iraq. We saw many cases like this. Many people have this character. I lived for a period in a Soviet part of the world. It's already there. It is more than more as human nature, like to be more than like cultural or regional characteristic. Anyway, as Zubair said, sometimes there's some anger or a result of any like trauma or any problem, or sometimes lack of understanding, like what is the disadvantage or the like effect from this character on the self when someone have this character on others. So it's like very variant, and dealing with it, maybe the psychologist and the therapist have more like knowledge about it. Yeah.
Thank you for that. As Brother Zabair also mentioned, that religion and culture influences people's attitude and perceptions, and it also has an effect on how we perceive mental illnesses. Although Islamically, it is highly recommended to look after oneself, to look after one's nafs and ruh and qalb. Although people's attitude that has been changed by their culture and their societies is quite contradictory to this. So people may look after their body, but when it comes to the mind, when it comes to mental health, it's often neglected. So, Dr. Abdullah, what are your thoughts on this? Why is this the case?
Like completely agree. This is a big problem. So there's echo. Yeah. Is my voice clear?
Yes, perfectly. Yes.
Yeah. This problem we faced like almost everywhere, even in Europe, but in some West, like Middle East countries, especially in Iraq, for example, if I can talk, it is much bigger for two reasons. First, the situations going there, like we have many wars, many political, economical problems happening there, plus the lack of medical health, like practitioners. Like in Iraq, it's very hard to find a psychologist. There is few psychiatrists, and this, from one side, high demand, like for a psychotherapy or a psychiatric therapy, and also high triggers for these mental health problems, which I mentioned now. Come together with these two problems, the stigma, the misunderstanding about mental health. Like many people think, okay, if I have psychological problem, I should just stop worrying and sitting home. Indeed, that, as the psychologists themselves said, it will not help the problem. What is wrong will not help it. So has a lot of factors. Some we can do something about it. Some, unfortunately, difficult. Yeah, maybe Brother Zubair have more to add.
Sure. Thank you so much, Dr. Abdullah. I think that's a really good point, thinking about which countries have resources and accessible treatment as well. I think you're completely correct there that on the level of religion, Islam really emphasizes looking after one's mind, looking after one's nafs. But that same attitude is not presenting in our mental health in the society and in the community. There's so much emphasis, isn't there, on our physical health, looking after your physical health, your diet, your going to the gym, you toning up, your making sure your physical health is good. but that emphasis is not played on your mental health. And mental health is always seen as something we need to shy away from, not focus on. And the irony over here, what Islam teaches us to be patient and compassionate to self and others. These are the fundamental teachings of Islam. And Alhamdulillah, what I've seen even in psychology, even some fundamental concepts of psychology, you can see these are the concepts we use in Islam as well. Compassion, understanding, patience, life being a test in itself. You know, in psychology, there's a really good technique called mindfulness, which has been extremely popular throughout the world. Now, if you think about the roots of mindfulness, that's from a Buddhist religion that we've used. And it's so funny, isn't it, that on a cultural and societal level, sometimes we don't demonstrate that compassion, that all-forgiving nature, that all-compassionate nature, even though our religion teaches us to do this. So this I see a lot in clinic. Often people are extremely vulnerable, they're extremely embarrassed, they're extremely reluctant to come forward, they're worried about what impact it will have on the society and the people they live with them. They worry about the future, you know, will somebody marry me? Will somebody marry my children? If there's that label of mental health in the family. But equally, when you look at religious values, Islam teaches compassion, it teaches understanding, it teaches to help others as well and help yourself. It's an empowering narrative which Islam uses. And therapy is very similar to that. It mirrors that empowering. We need to empower the person, empower the community. But I think there's a gap there somewhere where religion and culture, unfortunately, there's a conflict there that it doesn't happen almost.
I totally agree with that. Dr. Abdullah, you mentioned that there aren't enough mental health professionals in Iraq. And I'm curious to know, why is that? Because surely a country like Iraq, where people have been exposed through war, conflict, and instability, surely the number of psychiatric disorders or psychological difficulties must be really, really high. So if the need is there, then how come the service providers are less in number?
Well, I'm not have any official statistic to see the reasons or any studies to talk about the reasons. But what can I assume? Like, first, that because of the stigma, maybe many psychiatrists or many those who have training in as like physicians who can't go to be psychiatrists will avoid this specialty. This is maybe can be a reason. I think the biggest reason would be from the academic level, when there is no enough opportunities, because such training need to be from the government side, that they have to open such programs to train psychologists and psychiatrists and consultants. I know like some of the colleagues here in UK try to be like or already in contact since years with the Iraqi government to build some training there for psychologists, consultants, but still it needs a time, such thing, unfortunately.
So what are the perceptions like in the Iraqi community when it comes to mental health? Is it something men openly talk about, discuss, or acknowledge? Or is it something that's just brushed under the carpet?
Well, there's a strong stigma, unfortunately, but like I believe we shouldn't give up, like, because still also many people who accept this, who acknowledge it, who visit like psychiatrists. If you go for any Iraqi psychiatrist clinic, you'll find it full, but there are few anyway. They will be always full for that reason. Still, some people will avoid it. This is from the psychiatrists, and unfortunately, we don't recognize, or the majority of people don't understand the difference between psychology and psychiatry. Just two different specialities. In Iraq, you will very hardly find a psychologist, unfortunately, or consultant. Wow. Even in some cities like Najaf and Karbala, I think maximum you can find 3 psychologists. So this is for a city with 1.2 million is nothing. There's many like issues here, but still like there's some psychoeducation going on, and hopefully in the coming years we'll see some change. Yeah.
In your practice, do you often see a lot of people with psychosomatic illnesses, people who come to you and they complain of physical pains and ailments, but the root cause is not actually, bodily. It's more to do with the mind. Did you get to see that?
Yeah, we see it a lot. Even that the physical problem have a strong connection. Like for example, my field mostly in diabetes. Like avoid. I'm not trying to go more technical, but for example, stress increase cortisol, which is stress hormone, and cortisol will increase the insulin resistance. So the cells will refuse the insulin, and when the cells refuse the insulin, the sugar will go up. So stress lead to high blood sugar, and many patients, like when we start see them, they go good, like normally they follow good diet, they follow like the medications normally, but their blood sugar not stable. In the last a couple months, we started with some of the colleagues in UK to adopt some stress management from the psychologist, from this cognitive behavioral therapist for those patients with diabetes. We saw really good benefit. In average, I see 20% enhancement in their blood sugar just because the stress management have a good strong effect from the physical disorders, and also we have what we call it medically unexplained symptoms, which symptoms like the patient comes say, I have heart pain, I have chest pain, I have headache, but there is no any organic disorder. So this is very connected, and we see it a lot as chest pain, stomach problems, and even sometimes to be developed for any physical problem, but it have the background as psychological or mental problem.
Is there any work that's being done to spread awareness amongst people in the local community?
Yeah, we try, and especially with Al-Atab Al-Abbasiyya program, and Brother Zabair, one of the team, trying to build such a psycho-education, we call it, and some, especially from between the diabetic patients, they start to go with it, and alhamdulillah, as I said, I evaluated about 20%, at least from the patient that I see and follow with.
Brother Zabair, talk to us more about this organization. This sounds like a fantastic initiative.
So, alhamdulillah, this is, I guess we recognize a need, that there's a need there, that unfortunately, as you mentioned, there's many instabilities, many wars, traumas in Iraq, and people have suffered, and sometimes there's generational trauma as well. And, I think sometimes we think this is only in the Eastern world, but it's in the Western world as well. The resources might be there, but how accessible are they? So, for example, in Pakistan, now there's an increase of psychologists, but how do you access them? Many people may be living in rural areas, they may have to travel miles and miles to the city to access a psychologist, or the psychologist might charge thousands of rupees, which the common man cannot afford, and therefore, how do you, access that treatment? Similarly, in England, alhamdulillah, there's excellent psychology service here, but many people still struggle to access those psychology services due to taboo, stigma, maybe language barriers as well. There's a lack of BAME practitioners. For example, I've seen throughout my career that there's a lack of male therapists, but there's a lack of Asian, Black, ethnic minority therapists as well. Then there's extremely long waiting lists as well. So if you see the system we're living in, even the system and society can make it difficult for people to access mental health problems as well. And just going back to Dr. Abdullah's earlier point as well, unfortunately, society can have a negative impact. So, what we have seen from the current pandemic, people have lost their jobs, people are struggling with stress, managing everything as well, and this impacts your physical health as well. And it's almost more acceptable to have a physical health problem rather than a mental health problem. And the problem is, even if you are suffering from mental health and you lose your job or you have to leave work, there's no safety net. Who will earn that? Who will bring in the money? You might be provided with some benefits in England, but in the Eastern world, there's no safety net. So you still have to force yourself, still have that stress, responsibility, and duties, which does not decrease. So, sorry, going back to your original question, we recognize there's a gap, and alhamdulillah, this is set up by a very kind colleague of ours, Annie Shamsi, and she, brought us together, recognized there's these difficulties, and a group of us, a very powerful group of, alhamdulillah, women have come together. We provided supervision, we provided training, and it's been a collective effort. None of this has been often like a government initiative. This hasn't been a funded approach. This has been a collective effort of good minds, good intentions, alhamdulillah. And I guess there's no bigger blessing that this is taking, form from under the dome of Hazrat Abbas alayhi salam. It's been such a good, with good intention. We've been able to provide remote therapy to people living in Iraq who are struggling. And, we've been flexible with timing, obviously time differences, to meet the needs of Iraqi people there, because there's nothing else they can access, unfortunately.
And this is something which is for free, so people who are unable to afford psychotherapy or treatment, they can access it from any part of Iraq.
Absolutely, it's completely free.
That is absolutely fantastic. I'm sure lots of people who are watching right now, and if there's any mental health professional who's watching this right now, should be able to contact you and maybe become a member of that team. Talking about culture, and that's something which is really difficult to challenge, because we often see that we tend to follow culture more than what our religion preaches, or what our religion kind of recommends, or has made obligatory. And looking after oneself is one of those things. What are the ways we can challenge these stereotypes? How can we bring that positive change within our communities?
I think Dr. Abdullah made a very powerful point that education is extremely important. If we can educate and empower the community, that can make big differences in terms of how people perceive mental health and breaking down that stigma and that taboo. Education is extremely powerful. If we go back years and years and years, I remember there was a massive taboo around vaccination, like, say, for example, the polio vaccination. People would not accept that. They didn't like that concept. They were rejecting that concept. And then there was a massive educational drive, educating people on common diseases and vaccinations and how to improve functioning and overcoming, like, the polio pandemic many, many years ago. What we need to recognize and what we need to accept as professionals, that you cannot change culture overnight. Alhamdulillah, we can do lots and lots of work, but this is a collective effort. It's work in progress. We are just planting the seeds right now in terms of changing. And I think, as Dr. Abdullah mentioned as well, the media has such a big part to play in this. I know, coming from my Pakistani culture, when I look at TV shows, dramas, mental health is kind of depicted as something you're completely crazy. There's no recovery. You should be locked up. You're doing these kind of really exaggerated behaviors. You're screaming, crying. It's portrayed extremely negatively and extremely badly. And if you think about it, if we're growing up watching this is what mental health is, in our mind, we're going to think, oh my God, somebody with a mental health problem is completely crazy. So the media has a big part to play in conditioning our culture as well. So it's slow progress. It's education, awareness, and empowering people. And I think providing a non-judgmental support as well. I think us as professionals have a duty to make sure treatment is accessible, treatment is appropriate as well. And this is something which can benefit the client rather than harm the client.
People often, become victims of discrimination and racism and Islamophobia and so many other things, and that all tends to have an impact on our mental health. I know these things are more prevalent in certain cultures, and especially people living in this part of the world, they are subjected to discrimination and Islamophobia and racism often. Can you give any advice to people who are struggling or going through some mental health difficulty as a result of this?
I just want to say I've had some very powerful cases in England, and this has really touched my heart, because unfortunately I've seen people who have come to England as asylum seekers fleeing trauma and abuse, because they faced extreme discrimination, extreme persecution due to their certain religious and cultural beliefs. So what we have researched and seen that certain sectarian violence exists in the Eastern country. These people are persecuted. They're not even treated as human beings. And then when they come to England and seek treatment, my heart goes out. And this is human inflicting violence on other humans. There's no compassion. There's none of the Islamic values being orchestrated there. This is just pure evil and violence which is being inflicted on other people, which is very, upsetting to see. We need to be a compassionate society, humanistic society, that we treat everybody the same. We're all humans. Nobody is different in any way whatsoever. With regards to experiencing some sort of racial discrimination here or some sort of prejudice, I would advise recognizing it. We often have this tendency to minimize the problem that, maybe they were just joking, maybe it's not as serious as I think it is. But the more we dismiss it, it just keeps on building. So recognize it. B, think of a plan. Okay, who can I talk to about it? If I'm recognizing this in the workplace or maybe somewhere else, maybe in the school, university or college, how do I address this? And you will find there's many departments in certain organizations that you can address and speak out about these difficulties. The more we speak out about these difficulties and the impact it has on our well-being, the more we can change. If nobody's reporting these difficulties or nobody's coming forward, we're going to assume that's fine, there's no problem. But if we report it and admit there's a problem, then we can obviously, society as a whole can do something about it when they see there's an issue here.
Definitely. Dr. Abdullah, your final words, any message you would like to give or any issues that you would like to highlight before we reach our end?
So, what Brother Zubair said, I want to add just really one important point, that as we want to help the society, not to attack it, not to revenge from it and using that problem, as our objective is to help them, we have not to to attack the culture, but first to understand it. This is very essential. Then to spot the problem or the thing which let's call it wrong or mistaken in the society, in the culture, and try to deal with it in a way to help other people. We don't want to revenge or do anything harmful. We want to help. So first we need to understand the culture. We need to understand how this culture understands us. If I give an advice, how will this advice be taken? And also to use that all the other opportunities, one of them, the religious man, the Islamic, for example, scholars will be a big helper, and they do indeed. They help us a lot by facing these problems, because many patients or clients or people, when they say something like we don't accept this, it's wrong, when we show them any, for example, agreement between this what we offer and the Islamic education, they accept it, and this is very essential. As our aim is to help, not to revenge or attack any culture or understanding. So this is the last what I can add.
Thank you so much for your insightful advice. Once again, thank you, Jazakumullah khairan, Brother Zabair and Dr. Abdullah, for taking the time out today. And
thank you for having me.
Absolute pleasure. Inshallah, next Saturday we'll join you again with another topic related to mental health. Till then, look after your mind and mental health. Assalamu alaikum.